Good afternoon, everyone. Welcome to this week's discussion and update on COVID-19 webinar. My name is Kathy Purdy. I'm a marketing manager here at Schoeneck King. Just a couple of quick housekeeping items to go over before we get started. Please enter your questions through the Q&A box located at the bottom of your screen, and we will do our best to answer those questions as time allows. Also, if you would take a moment to complete the brief survey once today's webinar has ended, we would appreciate that. Our attorneys and presenters do look at your comments and suggestions for future programs. So to get things started, I'm going to hand it over to Pete Jones.
Thank you, Kathy, and good afternoon, everyone. Thanks for being with us. We've got a full program again today, and we thought we'd start off with vaccines today. We're going to have two presentations on vaccines. The first, we're going to have from Hermes Fernandez, a member in our Albany office. Hermes is going to just walk us through where we are, with vaccines, provide us with some numbers, things of that nature. Hermes, take it away.
Okay. Well, thanks, Pete. I'm going to try and synthesize for all of you where we stand on vaccinations. The watchword on vaccinations is patience. Right? Where we were last year in February of last year was we hadn't actually had cases in the United States yet. In that period of time since, we obviously have had far too many cases, and now up to over 400 and almost 70,000 deaths, which is the equivalent of wiping the city of Miami off of the face of the United States. Sobering numbers but vaccines are and will be our primary defense, apart from staying separate and apart from mask wearing. There are now actually 6 vaccines that, by my count, that are actually in use in the world today. Only 2 of those are being used in the United States, the Pfizer vaccine and the Moderna vaccine. Johnson & Johnson's vaccine, which is a one-dose vaccine, so that makes it something people are very interested in, is expected to be available in the end of this month. It's expected to be approved by the end of this month. If that's the case, the Johnson & Johnson vaccine will add 100 million more doses available to people in the United States, and that's a one-dose vaccine, so that really will greatly affect availability. But apart from Pfizer, Moderna, and Johnson & Johnson, the other primary vaccine, and the one that early on was regarded as having the most potential, was the Astrazeneca Oxford vaccine, which has not been approved for use in the United States, but has been approved in much of the world, in England and other places. That vaccine is cheap. It's $3 to $4 a dose. It can be maintained at room temperature and normal refrigeration, so it also was deemed to have an ease of distribution. Difficulty there has turned out to be, as we have heard about variants developing in terms of the disease itself, a variant has developed in Britain. Another variant has developed in South Africa. The AstraZeneca vaccine has not proved to be effective against the South African variant and has now been removed from distribution in South Africa. It remains to be seen what will happen in the rest of the world. Thus far, it still seems to be effective against the British variant, and is still being used in Britain and much else of the world. There's also a vaccine that Russia had developed, and there was some dismissiveness about the Russian vaccine early on because it was really introduced several months ago, or maybe around September of last year. It seemed to have gone forward without much in the way of actual clinical trials. The Russians, showing a sense of humor, call their vaccine Sputnik 5. And that vaccine, the Sputnik 5 vaccine, is now showing a 91.6% efficacy rate, which is fantastic. That is along the lines of the vaccines of the Pfizer and the Moderna vaccine. Mexico has just approved the Sputnik 5 vaccine for use in Mexico. All of these developments are very positive because those add to the simply to our supply, and supply is key at this point. There is also a vaccine that's been developed in China, and China is making use of that vaccine throughout its population. So that means we've got 6 vaccines currently in use. 132 million people worldwide have been vaccinated, which seems like a lot, except when you remember that the population of the world is over 6 billion people. Let's bring it closer to home. In New York, we have a population of over 19 million people. Thus far, as of Sunday, 933,000 New Yorkers have received their second dose of vaccine, which is significant. That means that is the 2-step process. That means those individuals have been fully vaccinated. That's wonderful news. That's about 5% of the population. We have a long way to go. The state expects to receive 300,000 doses next week and continue to receive about 300,000 doses. I just was informed that the president has announced that there may be another 50 million doses available sooner than expected, and all of the supply that can be increased as the vaccination process can be accelerated. That becomes increasingly important. It becomes important not just for bringing us all back into the workplace, back into bars and restaurants and into our normal lives, but it becomes important because there is literally a race between vaccinations and the virus. The viruses mutate, right? I can't explain to you why they mutate, but I will claim that you should listen to me because I attended the same high school as Dr. Fauci. So viruses mutate, and viruses mutate quickly. Most virus mutations mean nothing. They are simply mutations. They don't seem to have an impact. But I mentioned the South African variant and the British variant. There's actually a possibility that there's a Southern Californian variant at this point. And to the extent that they mutate, the question that comes up is, are the vaccines that have been developed for these viruses going to be effective? As I mentioned earlier, the Astrazeneca vaccine doesn't appear to be effective against the South African virus. So we want to get people vaccinated quickly, not just to bring us all back into the world, but also to win this race against the viruses, so the vaccines will be effective. The other piece here that becomes very important is that as vaccinations occur and as you limit the spread, you reduce the ability of viruses to mutate, and that's simply because if a virus isn't replicated, it can't mutate, right? A virus's mutation processes simply are based upon their ability to continue to mutate. Some of the risks that we're also seeing is this British variant, which is projected to become the dominant virus in the United States by the end of March, right, which is only 6-7 weeks away, is expected to be more contagious than the SARS-CoV-2 virus that we've come to know and love. It's expected to be anywhere from 30 to 50% more contagious. And what that means is, if you remember early from last year, really, when Governor Cuomo was talking, especially in our March, April, May timeframe, about the R factor, right? That R factor is simply the replication factor. How contagious is the disease? And you want the factor to drop below 1, because that means you have fewer and fewer people becoming infected. Well, if the particular virus is 30 to 50% more contagious, more people become infected, right? It doesn't mean the virus is necessarily more, is going to increase its virulence. It doesn't mean that it's more likely to cause a particular person to become ill or die, but it means you have more people getting the disease, and more people getting the disease does mean you have more people becoming ill. It also means that as we deal with variants, you don't know whether the disease will remain as it has been, mostly, not completely, but mostly more serious and more fatal among older people. one of the lessons of the Great Spanish Flu of 1918 to 1920 is the primary individuals who suffered and died from that virus, right, from the flu of that era, were men in their 20s, right? A very different circumstance than we face now. But with the mutations, right, one of the things that has to be looked at is are the mutations going to turn into a disease that affects younger people more than it has up to now. So we're in a race between vaccines and viruses. We've got 6 vaccines worldwide. There is still more to come. Johnson & Johnson, particularly for us in the United States, in the next month, that will be very effective. The Johnson & Johnson vaccine, by the way, is thought that it will be extremely helpful for rural areas because of its ease of its distribution. So Pfizer and Moderna may still in urban areas be the primary vaccine, and Johnson & Johnson may become the vaccine of choice in rural areas. The only other point that I'd want to make today is going along with the idea of patience. At this point in New York, as in really the rest of the country, there are 2 priorities, the 1A category and the 1B category. The 1A category was frontline healthcare workers. There are other folks as well, but frontline healthcare workers. 1B is now everyone over age 65, police, firefighters, first responders, and now restaurant workers and those with comorbidities. The 1B category is so large that between 1A and 1B, 7 million New Yorkers are now in the priority, which is almost the same as having no priority. That's why you see the long lines. That's why you see the sad stories on the news that people saying, well, I can't get my mother in. I've been online for 24 hours straight. People can't get there. That's simply because we have so many people in the queue. That is not going to get better anytime soon, right? So it's simple arithmetic. If the state's getting 300,000 doses a week, and you've got 7 million people in a priority category, I mean, that arithmetic alone, right, says we've got 21 weeks to get through the priority categories before you get through everyone else. 21 weeks is, right, almost 5 months. So patience, we can get through this. We all need to continue to do what we have to do, which is avoid each other, wear masks, wash our hands, wait our turn. Pete, that concludes my presentation today.
Hey, Hermes, real quick. You said something that caught my attention. I hadn't heard this before about a potential California variant. What, if anything, can you tell us about that just briefly?
Very little. There's just, I was reading some preliminary pieces talking about, is there a Southern California variant developing, or is it simply the British variant that has made its way into Southern California? They're not sure, but either way, the concern is it becomes a more contagious disease, so that R level, the replication level, goes up and more people can become ill more quickly.
Okay, thank you. As usual, a lot of good information in there. Appreciate the update. Our second presentation today on vaccines is going to be from Andy Bobreck. Andy's a member in our Syracuse office. A lot of what I've asked Andy to sort of focus on today is stuff that we've talked about before, but we continue to get these questions. It's obviously top of mind, critical questions for people. So Andy's going to walk us through, a second update on vaccines, and this relates more to, can you mandate? What happens if somebody refuses, et cetera, et cetera. Andy?
Thanks, Pete. Good to be with you. Good to be with everyone. I agree, as in the course of my labor and employment practice, one of the most frequent inquiries we're getting about COVID relates to the vaccinations. Understandably, people are eager to have these vaccinations rolled out. And it raises a number of questions from employers. I think most pointedly, can we require our employees to be subjected to COVID vaccinations? That's a question we continue to get over and over again. And as you've heard us say before, the answer is most likely yes, you can require employees. There is guidance from the EEOC that while not saying that exactly, indicates that, we think, with clarity. But that's not the end of the analysis right there. I think there's a number of things to keep in mind with respect to this issue and mandating employees to get vaccinations. We want to cover some of those today. I think to just go back, keep in mind that we have a new president, we have a new administration since this EEOC guidance came out. I was on the EEOC's website before this presentation today. That information remains the same, but right now we're in a very dynamic environment with respect to policy and guidance on the part of the federal government, as we see with any changeover between parties. So stay tuned. There could be more information on that. One issue that popped up with respect to the mandating of vaccinations was the emergency use authorization that these vaccines were created under and approved under through the FDA. And as part of those procedures, the EUA procedures, employees or those who are receiving the vaccination need to be apprised in writing of the fact that they have the right to accept it or refuse the vaccination. I think going back to the fact that this was approved under the emergency use authorization procedures. So does that somehow trump the EEOC's guidance? In other words, somebody can raise their hand and say, no, I'm going to exercise my right not to have this vaccine under the EUA. Does that somehow trump the guidance that the EEOC has put out and employers' ability to mandate vaccination? Our best read of this situation is that it does not, that you can read these two provisions concurrently. But again, it's something we need to monitor. And I think monitoring is a good point to mention, because as Hermes pointed out, right now there's limited supply. And the reality is most employers aren't going to be in a position to mandate vaccination on the part of employees just as a practical matter, because of the supply is so limited right now. As I mentioned, the fact that we as a general matter may be able to mandate vaccination on the part of our employees, that's not the end of the story. There's a number of issues relating to somebody's protected status that need to be taken into consideration. Namely, that the individual cannot be vaccinated because they have a disability or because they have a sincerely held religious belief. If either of those issues come up, there's an analysis that you, the employer, need to go through to assess that issue. You need to have an interactive process, a flexible one with the employee, that you understand if it's a disability, the nature, scope, and duration of their disability, and how it impacts the vaccination requirement. Likewise, if an individual has a sincerely held religious belief, you need to have a discussion with them, understand how it impacts their ability to have the vaccination. And then we need to conduct an analysis of whether there's an accommodation that can be provided. And I think it's important to note here, this analysis is really going to depend on the type of job that the employee is performing. For example, are they exposed to people on an everyday basis, members of the public, or is their position more reserved and out of the public eye and away from folks? Likewise, are there alternatives to working live? I think of this in terms of certainly a hospital, right? You have individuals who are providing care on the front lines. And if somebody can't be administered the vaccine because of their sincerely held religious beliefs or because of their disability, well, we can't necessarily just have them continue to operate on those front lines without some kind of protection. Conversely, if you're in an office setting and you have somebody who has very limited interaction with other employees or members of the public and who can perform work remotely, well, then the analysis there in terms of what kind of accommodation we may be able to provide as an alternative to the vaccination is going to be different. So again, I hope the takeaway here is just keep in mind, you don't want to paint with too broad of a brush when it comes to analyzing these issues. If you're going to implement a mandatory vaccination policy and you have an employee who raises their hands to explain that they're not able to do this. Conversely, I think when you go through this analysis, if somebody raised their hands and they just express a generalized fear about the vaccination, or they don't believe in COVID, or they don't believe the vaccination is real. Well, certainly those aren't protected reasons for that individual not to seek it. And you can, again, you want to analyze that, but that's a different level of analysis that you need to go through. And you're not going to necessarily end up with an obligation to provide a reasonable accommodation. There could be collective bargaining issues too. If the employer is going to roll out a mandatory vaccination policy, there'll be a question, do I have a duty to bargain with the union that we have in place over implementation of that policy? The place we're going to start in analyzing that issue will be the collective bargaining agreement, see what kind of language there's in there, potentially addressing this issue or providing management with the rights to roll out such a policy. But again, don't miss that issue, because I can tell you many unions out there are of the view that the implementation of a mandatory vaccination policy is a mandatory subject for negotiations. Likewise, if employees in the workplace, whether it's unionized or non-unionized, if employees are banding together to protest implementation of a vaccination policy, or they're grouping together to discuss about their concerns, whether on social media or otherwise, with implementation of a vaccination policy, that can be activity that's deemed protected and concerted under the National Labor Relations Act. And accordingly, we could not discipline an employee for engaging in that kind of activity. So we want to be careful there and analyze that issue well. And again, keep in mind that applies not just to unionized workplaces, it applies to all employees who are covered under the National Labor Relations Act. Why don't we move forward to the next slide, Kathy? So just practically, as I mentioned, we don't need to get ahead of ourselves right now. Certainly good to anticipate what we may want to do once there is more widespread availability. But this is an issue right now. If I'm looking at your to-do list, I might not have this right at the top of my list because as a practical matter, there just aren't enough vaccinations to go around right now for most employers to implement a mandatory requirement. The next two bullet points, what do we do if somebody refuses in staffing? I think you have to think about this issue too. All right, we have an employee who just point blank says, I'm not going to do it. They're not protected based on disability or status or their sincerely held religious belief. They're just not going to do it. And they're perfectly fine with the alternative of not coming to work. Well, that might not be a problem with one employee, but what if 10 do that? What if 20 do that? Their refusal could certainly have an impact on your operations. I think you have to weigh the impact of drawing a clear line in the sand with respect to a mandatory policy. Education is also key. If you're going to roll out a policy, frankly, whether it's voluntary or mandatory, communication with employees will be critical. You want to have them understand how the program will work, where they can reach out to if they have questions or concerns about the policy. And likewise, it'll also be important for you to engage in direct training with your supervisors, your frontline supervisors. They'll be the ones who ultimately field the questions or concerns from employees, and you want to make sure that they're armed with the information they need to address and respond to those issues. Another development we're seeing come up more and more are incentives for those who may get vaccinated under a voluntary program. This is an issue right now that's in a bit of a state of flux, due in part to the changeover in administration and some of the guidance that the feds have put out before on certain wellness programs. Right? So the question is, can we provide some type of monetary incentive for employees to be vaccinated? Again, we're in an uncertain area right now with respect to this issue and whether or not it's legally defensible. What I would encourage you to do is to work with your labor employment attorney here at Bond to assess that if that's something you're looking to implement. I guess just as a side note, I would mention too that there are some downsides, I suppose, to implementing some type of incentive program. Not the least of which is it tends to undermine, I think, the notion that this is something that's important for everybody to do, just as a general matter, when they're eligible and when the vaccines become available. Kathy, can you just flip to the next slide quickly? Okay. So we talked a little bit about the availability also. I think paid time off is an issue that comes up with respect to the vaccinations. There is legislation pending right now that would provide paid leave for employees who are seeking vaccination. It would provide them with 4 hours of paid time off per shot. That's, to my knowledge, and Katie can correct me on this when she presents, but I think it's still pending right now, but we do expect this to be enacted before too long. Absent that, I think there's an argument that paid sick leave, which covers the new paid sick leave requirements, which does cover a wide range of conditions on the part of the employee, but does include preventative care as a covered qualifying need for leave. That could obviously fall within a vaccination pursuit on the part of the employee. So again, even absent that new legislation, could be that PSL could apply there as well. Compensability, another question that we're facing. If we are requiring an employee to obtain a vaccination, is that time compensable? I think this is an area too where the facts and circumstances will matter, and you're going to want to work with your labor attorney on that issue too. I think I just add here, this isn't an exhaustive list, but I think I echo Hermes' notion of patience here. I think with this issue, you don't want to get too far ahead of yourself, because there's much that's uncertain at this present time, and frankly, ultimately, the passage of time alone may resolve many of these issues as people slowly are becoming eligible for vaccination. More of our population becomes vaccinated. We could see the dynamics change, and the need for a mandated policy to also change too. Pete, thanks.
Thank you, Andy. I'm sure we'll continue to get questions on this as it evolves, and we'll keep following it for everybody. Let's turn now to Adam. Adam Mastroleo is in our Syracuse office, and we thought today might be a good time to just kind of take stock of our operating plans and maybe get a little perspective on where we've been and some of the issues that we see that are recurrent. So, Adam?
Pete, thank you so much. It's great to be here again today. As Pete said, what we want to do is kind of take a look at the historical context of these COVID operating plans. And then I'll have some recommendations for you now that might be helpful. And I'm also going to cover some of the pitfalls that we've seen over the past 10 months with employers putting together these plans. So for historical context, as you all remember, I'm sure, back last March, the governor implemented New York on pause. And so any business that did not fit within the definition of an essential business, as the Development Corp defined that term, had to cease in-person operations. So we had a period between March and May when only essential businesses were operating. And at that point, the state hadn't provided these businesses with any guidance on what safety precautions they should be taking or what procedures they should be implementing. So these businesses were really doing their best, trying to come up with a safety plan without any real guidance for the plan. In May, we saw the state release and begin its phased reopening plan. And as part of that phased reopening plan, the state released guidance documents by industry. So for example, if you were a manufacturing entity, essential or not, starting on May 15th, you had a document that the State Department of Health put out that would guide you in preparing a workplace safety plan. And as many of you remember, those workplace safety plans included things like social distancing requirements, PPE requirements, requirements for cleaning and disinfection, screening, and then they also included some recommendations for how to respond if there were an infection in your facility or plant. So with the phased reopening guidance, businesses now had some guidance, much more complete guidance than they had before on how to operate. So what we saw our clients doing really fit within a number of categories. If you recall, there was a template that the state put out, and the state used this template for all of the reopening guidance. It didn't matter if you were a manufacturer or an office space, the state used the same template. So what we saw from clients was you either didn't have a plan at all, which almost no clients did. You had a plan that used the template. So you downloaded the template from the state's website and you filled out the lines that were provided by the state. Or you created an actual plan that followed the guidance. And at the time, if you were with us and you were attending these webinars weekly, you know that we recommended you go through the guidance that was applicable to you and really put together a plan that followed that guidance. So everybody got their plans in place, whatever they did, whether it was the template or a more detailed plan. And most clients, for most clients that I have dealt with, those plans have kind of sat. And when I say sat, I don't mean that you weren't following them, just that you weren't making serious or significant modifications to them. So from June or July, depending on your industry, until now, many of the plans have just been dormant. Now, what I want to do is talk about some recommendations for looking at those plans right now. I think now is a good time to look at those plans and some changes that you might want to make. So first of all, I think that everyone should look at your screening procedures. You should, whatever procedure you were using, remember the state gave you different options, whether you're using an online system, a phone-in system, a paper system, whatever system you're doing. Now is a good time to take a look and make sure that it is being followed. So who is responsible for collecting or monitoring screening responses? Make sure that is happening. Make sure that you have a process in place for notifying people if they forget or they don't fill out their screening. So for example, if you're in office and you use an online screening tool, well, if someone comes to work, you should have a way to make sure you know whether or not they've actually filled out the online screening tool. If they hadn't, there should be a way to make sure that you remind them or tell them that they have to do that. With respect to the screening questions themselves, make sure that you have updated those questions to follow the most recent guidance from the state. For example, in November, the state put out its most recent travel guidance, which changed the duration, or excuse me, it changed the structure of how the state is screening for travel. So for example, you might have been asking before the state put out its revised guidance in November, you might have been asking if your employees travel to a high-risk state, because that's how the state was defining it before that. Make sure that your questions have been updated, because the state no longer has a list of high-risk states. The state just has non-contiguous and contiguous states that are relevant, or international travel to a level 2 or higher country. Make sure that the questions are mirroring what the current guidance is. Another thing that you should pay attention to with your screening is that your employees understand what you mean when you're asking about close contact. One of the questions that the screening questionnaire is supposed to ask is whether or not the employee has had any close contact with an individual who's positive for COVID-19. Make sure that you are clear on how you're defining close contact, and that your employers are also clear on that definition as well. Another thing to make sure that you're doing with your operating plans right now, or something that would be good to revisit, is revisit your cleaning and social distancing protocols. Now, not a lot has changed since the original guidance came out back in May and June with respect to social distancing and cleaning protocols, but now is a good time to make sure that you're following them. If you have a positive case, make sure that your cleaning protocols are being followed. Make sure that you have a system in place for ensuring that disinfection is taking place when you have a positive case and in the areas where that positive case was. Some new guidance came out from OSHA last week, or a couple of weeks ago, I should say. We talked about it on this webinar. That's something to check as it relates to your cleaning and your social distancing protocols. Make sure that you understand what OSHA is recommending, and if there's anything you need to change, that you are doing that. We should also, at this point, make sure we're keeping an eye on what is coming out of the new administration. We have heard President Biden talk about changes or updated protocols from a number of different agencies. We will obviously keep you updated on those, but you should also make sure that you on your own are checking to see if there's any updated guidance. Another thing that I think it's important for businesses to update right now is your infection or exposure response plans. Many clients of ours had these plans in place, but didn't really have to put them into place until late last year when cases started to spike. I can't tell you how many calls I got in December where someone would say, we've been good up into this point, and now we're seeing all these cases. What do we do? So just make sure that you have a clear process in place for how you're going to handle positive cases, close contact, or symptomatic employees. It's helpful, and I've recommended this to a number of clients, for you to run through some tabletop exercises. Go through scenarios with whomever it is that is responsible at your business for dealing with these things. Go through scenarios. Make sure you understand what steps you're going to take in the different scenarios. I'll close up with discussing briefly some of the pitfalls that we've seen, and I think they can be broken into 4 major categories. Number 1 is not having a plan. So I would assume that if you're on this webinar with us, you take your COVID plan seriously, and you probably have a plan. So that's probably not going to be applicable to most of you on the Zoom call today. The second one, and I think this is an easy one to overlook, is not following your plan. So you may have a plan in place, you may have the best of intentions, but you have to make sure that you're following your plan. If you're in an office, people need to be wearing masks when they're walking around the halls and they're in between offices. They need to make sure they're wearing masks when 6 feet of social distance can't be maintained. Make sure you're following your plan, not just for your employees' safety and health, but also because you don't want to deal with an audit from the Department of Labor or the Attorney General's office. The third category of pitfall that I've seen is not being prepared. So you encounter a situation like a positive case or a close contact, and you don't know what you're going to do. You have a piece of paper that says what you're supposed to do, but you don't really understand it. So make sure that you go through and understand how you're going to respond to the various situations. And the fourth major pitfall that I've seen is not understanding your legal requirements. So this applies not just in operating plans, but also with leave requirements. Understanding when paid leave is supposed to be provided. Understanding when an employee can or should be in the workplace or can and should be home. So understanding legal requirements is the fourth major category of pitfalls. So Pete, that's a brief update on operating plans, what's relevant for now, and some pitfalls you can avoid.
Thanks, Adam. I mean, one of the things that I guess I would distill from your distillation, if that's a concept, is, trying to maybe take a step back and simplify some of these things for yourself. I mean, we have gotten down to a level of granularity which is necessary and which is helpful and sometimes very important. In this particular situation, under this set of facts, under this guidance, what are we supposed to do? You're taking us back out, zooming back out for a second, excuse the pun, to say, let's keep in mind the big picture, that we need a plan, that we need to make sure that we're following the plan, that we need to anticipate when the plan is going to come into play, how we might react, and that we need to always view that through the overriding practical and legal background so that we can, make good decisions. And I think sometimes it's helpful to zoom out a little bit, to take a look at, what we're supposed to be doing. It may help us understand what the overall picture is, but also liberate us a little bit from the granularity and the minutia, which can be very, very tiring. And sometimes there's no good answer to those. Anyway, okay, let's turn now to Katie. Katie Anderson is going to give us an update from Albany, the weekly update here. There's always a fair amount to comment on. Go ahead, Katie.
There always is. Let's start with what's been a usual presentation now, what the cases look like across New York. We see that there's been a steepish drop off in cases. Today, actually, the numbers show that there is a slight increase in cases, but remember, these things fluctuate on a daily basis. It's much better to look at this on a 7-day average. But while it's good news that cases are decreasing, you have to remember where the caseload is right now. We are at such high levels that are still equivalent to April, May of 2020. So it's still very widespread. Every single county in New York State is marked as an extremely contagious zone. So COVID, while decreasing, it's still coming around. And like Hermes mentioned, in March, we're suspecting that the British variant will be the dominant variant. This variant is doubling every 10 days in the United States. That is alarming in that it's a very contagious variant. So what does that mean going forward then? Well, we have some vaccines and more vaccine talk. Last week, the governor announced that people with comorbidities will be able to receive the vaccine on February 15th. Beginning February 14th, which is Sunday, people with comorbidities may start to apply to receive the vaccine. These are the comorbidities that qualify you to receive the vaccine. Feel free to screenshot it, but these slides, as always, are available on our website. These are also available on the New York State website about the vaccine to take a look and see which comorbidities will be covered. But one thing as well is that all of the time, every time you're receiving a vaccine, you need to bring proof for the other for the groups 1A, 1B. You know, if you're in the over 65 group, you have to bring something that shows how old you are. If you are a nurse, you have to bring something that shows that you are employed as a nurse. For comorbidities, there are 3 validations that you can bring. First is a doctor's note saying that you have one of those. Second is medical information evidencing a comorbidity, which I'm not quite sure what that means, and we haven't been provided with guidance about what that would entail. That would be different from a doctor's note. And then finally, a signed certification. This one, and we're still waiting for more guidance from the state on this, but this one is up to the local governments, according to what the governor said yesterday. It would be presumably you show up and you certify that you would indeed meet one of these comorbidities. It's interesting that this is being shifted to the local governments to decide whether or not to use this certification. But again, we still don't have a lot of information to give you on this specific component. So those are the biggest updates with the vaccine in New York. But then there's also this bill that Andy mentioned. This bill is a big bill. And it's moving. This bill would require employers to provide a paid leave of absence for employees for a sufficient period of time not to exceed 4 hours per vaccine injection to be vaccinated for COVID-19. So that is up to 4 hours per COVID dose. This bill is moving, and it seems like it is will be passing the Senate at some point. It passed the Assembly last week. It was reported favorably out of a Senate committee yesterday, meaning that it's increasingly likely that it will pass. When you move through committees, that's where things tend to get held down. Also important to note, this bill passed the Assembly with overwhelmingly bipartisan margins. There were only 13 people out of 150 that voted against this bill. So this bill does have some steam to it and a lot of support. I would not be surprised if this passes very soon. The leave of absence needs to be provided at the employer's regular rate of pay, and it cannot be charged against any other leave that employee is entitled to. Also, the bill explicitly notes that a collective bargaining agreement may provide more leave for people for vaccine, and that needs to be followed in that instance. But this is the bill that is moving, and this is the one that's going. There have been a few different bills. There's one in the budget. There was another one moving around the assembly, but this is the one that seems to be picking up the steam. It's a 4 hours per vaccine injection. I know we've been talking about other ones that were 2 hours. This one's 4 hours per vaccine injection. So that is a change, but it looks like this is the one that's going to go. A few other updates, just very quickly. Looking at restaurants, on Friday, a judge issued a temporary restraining order that allowed the plaintiffs, which were 94 bars and restaurants in Buffalo, to remain open after 10 p.m. The state has announced it's going to be appealing this. It has not applied it widespread to other restaurants and bars in the state. So that is a big change in where we're going with restaurants and bars. There's a good chance that the governor didn't want to challenge this because of the Super Bowl, didn't want to change it throughout the state because of the Super Bowl. There is a good chance that this may change in the upcoming weeks to allow restaurants and bars to be open later. Also, the governor changed that restaurants may open at 25% capacity in New York City beginning on Friday. Originally had announced that it would be on Valentine's Day that they could open. Finally, and I thought this was worth mentioning, I know it's not an Albany update, but it is an important update for New Yorkers. Anybody who had a loved one die from COVID-19, FEMA is going to provide the funeral assistance program, which will provide up to $7,000 in burial relief retroactively from January 20th, 2020 to December 31st, 2020. We know that New York's representatives are working to get that expanded to this year as well. But FEMA has done this before. This is the largest scale, though, that we've seen the amount of deaths. You know, we have more deaths from COVID than we do from Hurricane Katrina or Hurricane Sandy. And so this is a big undertaking by FEMA. There haven't been a lot of announcements or guidance yet about what you will need, but you will likely need all your billing and invoices of the funeral costs and death certificates. Those, you know, it's a little different than what we usually are looking at, but it's important to look at, and it could be a real benefit for a lot of people across the state. So that's it for me, Pete.
Thanks, Katie. We got a fair number of questions in the chat about how the 4 hours will work. And I think the short answer is we have to wait and see. Obviously, there have been different ideas out there in terms of what the legislation itself might say. Once it is finalized, and assuming it's not amended or somehow changed, we then would parse it to try and figure out the various permutations. I'm always impressed with the quality of our questions here, that people want to know exactly how it's going to work, and we'll stay on that for you. But I don't think we can answer those questions yet until we get actual legislation and language that we can parse, and then presumably we'll get, as we have in the other areas, guidance which precedes regulations. So thank you everyone for being with us today. We appreciate it as always. And we'll be back here again next week with another update. So in the interim, please stay safe and we'll talk to you soon.